Thank you, Sarah, and welcome to everyone to this webinar. DSDR, this is about DSDR, which we call Population Health Archive, and we're excited to be 20 years old this year for Be Sharing Data. Next slide. The DSDR team, you've met, of course. We have two wonderful project managers working on the team, Sarah Rush and Kelly Agenshuti, and I'm John Marcotte. I'm the project director. Next slide, please. DSDR is funded by the Population Dynamics branch of the Eunice Shriver National Institute of Child Health and Human Development. We're also hosted by ICPSR at the University of Michigan. So go blue. Next. DSDR is a platform for the discovery, access, and sharing of research data for population health studies. You'll be hearing more about each of these aspects of DSDR in the different sections of the presentation. DSDR, we seek to be a locus of information for researchers who collect, analyze, and distribute primary data, as well as to help people do secondary data analysis. And DSDR is celebrating its 20th birthday in 2024. So we're excited. We're 20 years old. Check out our new logo that has some cake and shows us celebrating 20 years. Next. So to give an overview here of Discover, Access, and Share, which are our bywords. Discover, we like to call a souped-up version of find from the FAIR data principles, which is it's more than just being able to locate data. It's being able to discover it, be able to search for it. And we have data that are related to topics related to maternal and child health, of course, health disparities, families and households, migration, immigration, and cross-national comparisons. We're also excited in some of our discovery that we have data on some underserved populations you'll be hearing about later in the presentation. So keep your eye out for those data. We pride ourselves on access, on being able to provide different levels of access, from downloading public research data to online analysis to restricted data that you can apply for restricted data through us. One of our real fortes is sharing. That's probably our main purpose, which is it enables people to deposit data with us, meet the NIH data sharing requirements, and we maintain the provenance, the history of the data, and we preserve the data. So if people want to do historic comparisons in the future, you'll be able to find that data with us, which is really important. One of the important things about sharing with DSDR is that we work with you to share the data. We don't just take the data and assume it's ours. It remains your data, and we work with you to share it in the best possible way. Next, please. So let's go into some more detail about discovering data and resources. So one of the things that's really important is you can find data on the DSDR website. We make the search button right prominent, right at the top of the middle of the page, so you can find it. And you can search across studies, do variable comparisons, search for publications. We have a first-rate bibliography, so you're able to search and find where people have analyzed the data previously, keeping in mind that science builds on science. Next, please. So our Discover page, we're particularly proud of because you're able to both browse by studies and being able to look for different aspects of with these different buttons that allow you to find different things. You can search for variables. One of the key services that ICPSR, our parent organization, has is the variables database, which allows you to search within studies for particular variables, finding out which studies have asked questions or ascertained information about a particular topic. That's vital. Furthermore, we have the ability to compare these questions across studies so you can see what's comparable and what's not comparable. So come and explore. That's what our page is. You can then also browse by subjects, and our key subjects, of course, are related to maternal and child health and population health. Next, please. So when you search for data, your search results come up and you're able to make various modifications to it. You can search the data, you can switch to variable or publication results, and You can do different sort options. So it's really nice once you have the search to be able to manipulate it. Again, something we're really proud of, the ability to manipulate your search results after you've completed a search. Next, please. You can do a variable search, and also that allows you to do a comparison. But the variable search is important because often what people want to know isn't just whether a study exists, but what studies have ascertained certain information. And so being able to do a variable search is really vital. Variable level metadata is vital to what we do, and this is a key thing to helping to make data discoverable. Next, please. As I hinted at, of course, with any of our searches, you can do a comparison. If you find variables from different studies, you can compare the question text, you can compare the responses, and you can see how comparable these studies are. Next. The publication search. Again, we have a first-rate bibliography. I want to say here that our team of librarians does an outstanding job on our bibliography. We do go beyond just what's published in PubMed, and we obviously include being able to find what's in PubMed, but we go beyond PubMed and the ability to find papers and working papers and presentations that have been published in a number of places. Next. Within study searching, our primary launchpad when you come to look for a study is to go to the home page, the study page for that particular study. And from there, you can launch a number of different items to look for. You can launch from. Our goal is to make things as accessible as possible. People come at information from different ways, and we try to make it as easy as possible to get to information. Next, please. I'm going to turn it over now to my colleague, Kelly Ogden-Schutte, to tell us a little more about accessing data and resources.
Thank you, John. Next slide, please. So there are different ways to access data and resources through DSDR. First, we have our public use files. For this, all you need is an ICPSR account, which is free, and to agree to the terms of use. With the public use data, it is available for download in a multiple standard formats, such as Stata, R, ASCII, and so on. And as you'll see on the slide, frequently under the Data and Documentation tab at the individual dataset level, there's also the option for ASCII plus setup files. Next tab, please, or next slide. For many of our studies, there are options for online data analysis. So SDA analysis provides a wide range of analysis options, including recoding and computing new variables. The Freaks crosstabs is our legacy system, which allows for a streamlined interface for building tables. Both are useful for exploring the data prior to download as well. Next tab, slide. DSDR manages data covering an array of topics, populations, and geographies. Some of our top downloaded studies in the last year have included AdHealth, the India Human Development Study Series, the MATLAB Health and Socioeconomic Survey from Bangladesh, the Mekong Island Population Laboratory, Generations, and TransPop. Next slide, please. Generations and TransPop are also study editions with LGBTQ data, along with the National Couples Health and Time Study data and chat. Next slide, please. Other new studies and additions and updates include babies' first years, the Los Angeles Family Neighborhoods Survey biomarker data, Project Migrantee, the new Immigrant Survey Series restricted data, and TLT2, which is based in Malawi. Next slide, please. Highlighted health data at DSDR includes the India Human Development Survey Series, the Los Angeles Family and Neighborhood Survey Series, AdHealth, the National Survey of Adolescent Series, and the NICHD Study of Early Child Care and Youth Development Series, otherwise known as SECCYD. Next slide, please. Documentation available for our studies includes detailed survey study descriptions, suggested data citations, code books, frequencies, and when provided, survey instruments and other data collection measures. We have data guides available for our Chitwan Valley Family Study Series, the India Human Development Series, rounds 1 and 2, AdHealth, and we are working on more going forward. Our data-related bibliography that John referred to has over 43,800 publications and is searchable by study, author, title, and year. It includes journals, reports, books, book chapters, and dissertations. Full text options are available for many of the citations. Next slide, please. We also have restricted data. These data require an application and approval process that includes a legal data use agreement, an IRB approval or exemption, a data security plan, and confidentiality pledges. As seen on the slide, we have 3 options for accessing restricted data: secure download, the virtual data enclave, VDE, and the physical data enclave. With secure download, the data is sent as an encrypted link for download to an approved non-networked machine. Researchers must review their own output for disclosure risk prior to sharing outside the approved project in any way. And at completion of the project, researchers must destroy any copies of the data. For DSDR data, all studies available for secure download are also available in the virtual data enclave. For the virtual data enclave, data remains on ICPSR servers and is accessed by remote encrypted connections from approved locations. This facilitates collaboration by allowing connection from separate locations and even across institutions. Output is reviewed for disclosure risk by DSDR staff and then released through an airlock and provided to the researcher. Finally, our physical data enclave is for a small set of highly sensitive studies. Data remain physically at ICPSR and are accessed in person by approved researchers by appointment only. Access to the data is monitored, and all output and notes are reviewed for disclosure risk prior to removal from the PDE. Importantly, for all access methods, researchers must follow protocols for protecting human subjects. And I'm now going to turn it over to Sarah to talk about how we share data. Thank you.
Thank you, Kelly. So I'm going to cover how you can use DSDR to share data and data-related resources with other researchers. Many of the reasons to deposit data have been touched upon by Kelly and John. However, I'm going to go through this list quickly. Depositing data with DSDR can advance science by making your data available to other researchers for secondary analysis. It can help you meet funding requirements, like I guess we're into the first year now of the NIH Data Management and Sharing Plan, or the policy rather. DSDR provides long-term secure preservation of data and documentation files. Data disseminated through DSDR are available at no charge and in a variety of formats. Data are cross-listed through the ICPSR membership archive and other topical archives within ICPSR as well, which increases the exposure of your data to a wide range of audiences. All studies released through DSDR received a direct object identifier, or DOI, to aid in data discovery. Data deposited with DSDR undergo data curation to enhance and add value. This process includes a disclosure risk review to ensure that data are adequately protected if they are released publicly, and also if they need to be released as restricted in order to protect respondent confidentiality. We also build and maintain a bibliography of data-related citations, which was already mentioned, for all studies in the DSDR data collection, and we announce data releases when they occur, both on our website, the ICPSR website, DSDR Facebook and X, formerly known as Twitter accounts. Finally, we provide ongoing support for researchers and data depositors, and this support is there throughout the entire process for both those depositing and those using the data. We have 4 deposit options that we make available to researchers. The standard deposit is what people typically pursue, and that's where data and documentation are deposited exclusively with DSDR, for which DSDR becomes the sole source of the data. While this is available for both public and restricted deposits. Restricted data have to be a standard deposit, with DSDR being the only point of access for restricted files. And the reason for this is that we need to make sure that we are maintaining the access and upholding proper protections for the data. The second is mirror deposits, in which the same data and documentation are available from multiple archives with one authoritative source. This is public access only for a similar reason that I described for the standard deposit. It's just not possible to uphold protections when the data are available in multiple places. And this type of deposit is useful when somebody wants to share data in specialty archives across different continents. The variable level metadata option, this is when variables, the variable level metadata is deposited and the variables become searchable through DSDR while the data and documentation remain at a study site. This is useful in situations where you have an ongoing study and frequent updates are occurring to the actual data. But having the actual variable level metadata within DSDR allows people to understand and compare what variables are in the data, but go ahead and pursue access to the data elsewhere. On a similar level, study level metadata, or we call them union catalog entries, allows people to learn about the study on the DSDR website, but then go to the actual source to access the data. This allows researchers to search and compare studies where data are available within the DSDR catalog to those available elsewhere. DSDR accepts deposits related to maternal and child health, health disparities, and the human life cycle in 3 priority areas set by NICHD. The first is data resulting from support by the NICHD Population Dynamics branch. The second is data that provide opportunities for researchers working within the scientific scope of the NICHD Population Dynamics branch that were supported by other sources. The third are data resulting from support by the NICHD Division of Extramural Research from sources other than the NICHD Population Dynamics branch that have an emphasis on behavioral and social science research data. DSDR can help with your NIH data management and sharing plans by providing letters of support, endorsing your research plan and data archiving plans. The ICPSR Share NIH Data page also makes several resources available. There's a template that you can download, and there's copy and paste language in that template that you can then insert into your own plan. ICPSR also provides assistance with budgeting for the cost of curation for data deposited with the SDR. We ask that you allow at least 10 business days for an estimation, and really the sooner the better, to ensure that we can give you an accurate cost estimate within your time frame. Finally, there are webinar recordings for NIH data management and sharing plan specific webinars, of which DSDR content is included in that, along with ICPSR's other NIH funded archives. So what to include in your deposit to DSDR? For quantitative data files, we ask that you try to submit an SPSS, STATA, or SAS, and include defined variable labels, value labels, and missing data codes. The defined variable labels and value labels really will increase the usability of your data, both when people download the data as well as when someone goes to use the variable level searching or comparison tools. We also accept qualitative data, video data, images, and geospatial data. For documentation, I like to tell people that anything you think would be useful for somebody going to work with your study, please talk to us about it or deposit it, because it's always better to have more to work with. And our typical deposits include code books or data dictionaries, data collection instruments, and user guides. We also ask that you deposit the respondent consent form, any project summaries, or also data-related citations that we can use to start the bibliography of data-related citations for your deposit. For the study description or the metadata, we require the study title, the principal investigator, and a summary. But we also suggest the study design, information about the sample, and methodology as well. Again, all of this information aids with both discoverability and somebody being able to really work with your data and use it well. Now, when you go to deposit your data, you can begin on the DSDR deposit page where there's a Start Deposit button. This will prompt you to log into ICPSR or to create a free account if you don't already have one. Next step will be a pop-up box where you can enter the title, which is, again is required for your deposit, and then you're taken to the screen that's shown here. So just a few things to highlight on the screen. Here, the DSDR test deposit was the title I entered. If you happen to deposit multiple times with us, you'll see that left-hand menu with all those DSDR dash numbers. Those are all different deposit projects because we're in My Deposit Space. And the top menu right under the title of your deposit allows you to create a folder, to upload files. Under that More button, it allows you to copy a project. Let's say you have multiple waves, but you need to deposit them separately. You don't have to start from scratch that way. Or if you decide you're not going to follow through with the deposit, you can also delete the deposit right there. Moving down the page, that middle section, the project description, scope of project, methodology, and related publications is where you would enter your study metadata. Again, the PI and the PI field and a summary are required, but the other fields, while optional, we encourage as complete of information as you're able to provide. The project communication log is a way to communicate with DSDR staff about your deposit. Let's say you've deposited, but you realize you forgot to tell us something. You can enter in a comment there and we'll get back to you. It's also my preferred way of communicating with the project team about any follow-up questions or information that we need. Finally, on the right-hand side of the page, this is where you can submit your deposit to ICPSR, and you can also share the project with other collaborators. I guess I should just mention that that button that says Submit to ICPSR is also where you'll see status changes along the way when it's under review and curation and then released. So over the course of 20 years of DSDR, we have built a collection of over 800 studies with data accessible through DSDR. We also have 170, actually 176, I believe, unique catalog entries that have study level metadata that's accessible either in other ICPSR archives or outside of DSDR. We have over 1 million searchable variables and over 43,000 data-related publications. So what's next? Looking to the future, we have new data on the horizon. Some of our next planned releases are additional data sets for the Chitwan Valley Family Study Series, additional age 1 and age 2 data sets for babies first years, additional data sets for the new immigrant survey series. We're also working to develop additional resources to help researchers with human subject protection and disclosure risk mitigation, meeting NIH data sharing and management policy requirements. And we're trying to get in new types of data. Video data, images, qualitative data are some of the types that we're focused on. Finally, we'll be developing additional data guides. So we hope that you'll connect with us. On the left-hand side is that QR code leads to our link tree. And within the link tree, there's the link to our Facebook page, our X account, or Twitter, and as well as numerous pages on the DSDR website, including a way to sign up for DSDR's quarterly newsletter, which includes updates on latest releases, as well as any other data-related events that we'd like to share with you. And then I also want to mention, if you happen to be attending this year's Population Association of America annual meeting, we hope you'll come by and visit us in the DSDR booth for a special celebration. And with that, we'll open up the webinar for any questions you have for the DSDR team.
Sarah, we did get a couple questions ahead of the webinar, so I'm just going to start with those while other people formulate their thoughts. So one of the questions we got was, can you tell me more about why DSDR is a population health archive? I don't know if you or John want to jump in on that.
I'll take that one. Thank you, Kelly. By population health, the data in DSDR have strong external validity, that they can be generalized to populations. This is really important in terms of how things are. We don't just have data that have only internal validity. We want strong external validity. Our mission in terms of health, while there's a focus on the individual, it's the impact on populations that's very important. What is the overall impact on a particular group, not just its impact on individuals.
Thank you, John. Sarah, did you want to add anything to that?
No, I think John did a really nice job of covering it. Thanks.
Okay, Sarah, there's John, there's another question. Do you have to be a member of ICPSR to download data from DSDR?
No, you do not have to be at a member institution or at a member institution computer. Data in DSDR are funded by the federal government, and because they're funded by the federal government, they are available without charge. We treat that completely. We don't put any barriers in front of restricted data. We don't charge for our BDE service or anything like that. So everything is available without charge on DSDR.
Thank you. So I think this next one is sort of directed at my area, which was talking a bit more about the requirements to apply for restricted data. So a question that comes up a lot is graduate students wanting to apply for the data, and you can, but you can't do it alone. The person who applies has to be principal investigator eligible at your institution. And so what that usually means is that a graduate student, somebody working on a master's, a PhD, that sort of thing, works with a faculty member who basically serves as a sponsor for the person applying for the data. And so then that person would be the PI, and then the student would be considered staff. Please note that being staff on the project does not limit your access to the data in any way. Everyone has equal access to the data once the project is approved. And then always please reach out to us and we can walk you through any other questions you have about applying for the data. And then the last question that we got so far is there a charge to deposit data?
And the answer is no, there isn't a charge to deposit data with us. However, resources are becoming more constrained. And if you include us in your grants and to do curation of your data to make it available, it certainly will facilitate us making the data available more quickly. One of the challenges we have is how long it takes to release data. Sometimes it can take several years to release data because of the backlog of data sets. With additional funds, we can hire personnel to work on specific studies. Again, our goal is to work with you, make your data accessible, not just to be handed data and say, here, take care of this. These are your data from your study if you're sharing with us, and we want to work with you.
Yeah, John, I wanted to add just one thing, and that's just a reminder that we are more than happy to meet even multiple times ahead of a grant submission. If you want to talk through the data management and sharing plan, or discuss your planned deposit with us, we're more than happy to do that, because we feel like a strong collaboration in the beginning leads to just a better data release in the end.
Great, thank you. We did get another question. People are interested in getting the presentation slides, and so they are wondering how that could be made happen.
So we plan to add the slides to Deep Blue, and along when we share the link to the webinar recording, we plan to share that link with you to the slides. So I would say within the next week, everyone who registered for the webinar will be receiving that follow-up email.
Great, thank you. At this time, I don't see any additional questions in the Q&A. And I think we've covered what we want to cover. So we thank you so much, everybody, for attending our webinar, and do keep an eye out for the recording and the slides. And as always, please reach out to us with any questions, concerns. We are always happy to work with you and to guide you through any of the processes. Sarah?
Yeah, I was also going to encourage you to check out the ICPSR International Love Data Week page, where you can actually adopt a data set from DSDR, as well as many of the other projects within ICPSR. Some of our I guess highlighted studies on that page are NCHAT, Generations. I think Baby's First Year is on there as well. And we will also be promoting those on social media. It's just a fun way to get involved with the Love Data Week celebration. So if there are no further questions, I'd like to say thank you again, and enjoy Love Data Week.